Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jessica Adams. This episode features Dr. Kenric Ware on the role of college campuses in PrEP uptake. Dr. Ware is an associate professor in the Department of Pharmacy Practice at South University in Savannah, Georgia, and chairperson and pharmacist on the board of directors of Joseph H. Neal Health Collaborative in Columbia, South Carolina. For the full online educational program, please visit the link in the show notes for this episode. Now let's get started and hear what Dr. Ware has to say about PrEP on college campuses.
Hello, thanks so much for joining us today. We'll be discussing the role of college campuses in PrEP uptake. Unfamiliarity with HIV pre-exposure prophylaxis or PrEP within populations that could benefit from it remains a barrier to PrEP introduction and uptake. Many college students report having sex, but when queried, commonly are unaware of PrEP. Therefore, college campuses are a useful venue for promoting activities to increase awareness of PrEP and position it as a popular and powerful strategy for students to manage their health. When thinking about ongoing conversations that we can be having, college campuses have the versatility to serve as highly interactive venues to increase PrEP awareness among a key target population. PrEP informational sessions on campuses can complement ongoing conversations within the student body. Students regularly participate in awareness events and other structured discourses whose formats are typically flexible enough that they can accommodate the inclusion of PrEP education or messaging. As one example, PrEP talks may fit into dormitory hall discussions, typically spearheaded by residency supervisors and required for residents to attend. Conversations about PrEP can also extend beyond in-person chats to encompass virtual audiences as well. In this respect, it is worthwhile to devise social media campaigns that entertain and inform college students about PrEP through frequently visited platforms. Now let's discuss the role of campus health clinics. University health clinics may also be valuable spaces to invite student discourse about PrEP. Unfortunately, some students may cite privacy concerns about confiding in campus-based healthcare personnel to gauge their PrEP suitability. These employees may interact with many clients, and students may be skeptical that all disclosures will remain confidential. Additional barriers to effective communication may include a lack of rapport with campus healthcare professionals or feeling stigmatized when entering student health clinics. To address these challenges, it must be a priority to create on-campus spaces for students that they trust and where they can learn about and assess PrEP's utility. Another component of this would be individualizing our approach. So college-based interventions can be useful for targeting specific populations or regions. Since the HIV burden in the United States uncomfortably rests in the South, for example, intentional collaborations with representative colleges can help to curb disproportionate rates of new HIV infections occurring in this locale. Individual campus cultures can vary, making it essential to consult with groups of local students to gain their perspectives about contextual nuances that may stimulate or perhaps stifle PrEP uptake on their campuses. Engaging targeted groups is a course of action that can help leverage the social capital possessed by certain students to optimize visibility of PrEP-centered communications. Individual students may emerge as PrEP ambassadors to their peer circles who can facilitate normalizing conversations about safer sex strategies. College students often point to prominent peers such as student athletes and members of organizations such as fraternities and sororities as ideal leaders when it comes to PrEP messaging. Faculty and administrative support must also be in place to bolster and amplify PrEP messaging from students. As a result, developing processes for identifying faculty and administrative PrEP champions is a strategic approach to establish the longevity of PrEP communications on college campuses. The methods that college-age students use to communicate are steadily evolving, providing adaptable opportunities to showcase PrEP through creative and contemporary lenses. The language put forth to describe PrEP to college students is important, as are the locations on campuses where PrEP discussions take place and with whom. As a result, campus-based personnel touted as being student advocates due to their accessibility have an opportunity to guide students as they cultivate environments that work best for them to explore everything that PrEP has to offer. Thanks.
Thank you very much to Dr. Ware, and thank you to our listeners for joining in. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you and have a great day.